Welcome to The Explainer. All right, today we're putting you right in the middle of an emergency. Imagine you're a first responder. The clock is ticking. You're getting a ton of information all at once, but only one little piece of it might be the key to saving a life. So here's the big question. Can you actually spot that critical signal through all the noise?
Okay, so let's really put your skills on the line here. I'm going to give you a scenario, and your job is to pick out what matters most. You ready?
So here it is. You've got a patient with hives all over, their heart's racing at 110, their oxygen is a little low at 94%, and they tell you, hey, it's kind of hard to swallow. Now, all of this screams allergic reaction, right? But which one of those is the real red flag? Which one symptom is telling you this could go from bad to worse, like right now? Go ahead, take a second and make your call. All right, to figure this out, we've got to look at each sign individually, because let me tell you, not all symptoms are created equal, especially when every second counts. Okay, let's break this down. First up, the hives. Yeah, they confirm it's an allergic reaction, but on their own, not immediately life-threatening, low danger. Then you've got the heart rate of 110. That's just a bit of mild tachycardia, totally common when your body is stressed out. Again, low danger. What about that 94% oxygen? It's on the low end of normal for sure. You'll want to keep an eye on it, but it's not a full-blown crisis yet. That leaves us with just one more symptom. And yeah, you guessed it. It's the one that's off the charts. You know, all those other signs are kind of like background noise in this story. They set the scene. But there's one symptom that's the main character in this potential tragedy. It's the one that's screaming about a really fast-moving internal threat. So if you picked difficulty swallowing, you nailed it. Absolutely correct. See, this isn't just another symptom on a list, it's a massive warning sign. In the world of allergic reactions, that is the loudest, most urgent alarm bell you could possibly hear. And here's why that's so critical. That difficulty swallowing, the medical term is dysphagia, it points to something called angioedema. Now, unlike hives, which are just on the surface of the skin, this is a deep tissue swelling. And when that swelling happens in the throat, well, it can literally close the airway completely. And look, this is not some slow-moving problem. Airway obstruction from angioedema can happen, boom, just like that, incredibly fast. A patient can go from just saying, hey, it's a little hard to swallow, to developing voice changes, maybe that scary high-pitched breathing sound called stridor, all in a matter of minutes. And that is exactly why this one symptom is a blaring siren to give epinephrine right now. So, okay, how do we take all this information and turn it into a simple, life-saving rule? Let's walk through the exact thought process that experienced responders use. And this is the big takeaway, the thing you absolutely have to remember. For any responder out there, if you see the signs of an allergic reaction and the patient complains about a tight throat, difficulty swallowing, or their voice sounds different, you have to treat it as a potential airway emergency. No question about it, period. You have to be suspicious, you have to act fast, because even a moment's hesitation could be the difference between life and death. And really, that just gets to the heart of everything, doesn't it? It's not just about the vital signs you see in that one single moment. It's about the trajectory. Where are things headed? That's what really matters. And with an allergic reaction, airway swelling is the one thing that can spiral from a minor complaint to a life-ending disaster in the blink of an eye. So the next time you're faced with a situation like this, what are you going to be listening for?